Hi, everyone. Steve Adubato. We kick off the program with Dr. Stephen Brunnquell, who is the president of Englewood Health Physician Network. Doctor, good to see you.
Nice to see you again, Steve.
You told our producers something that we want to share with everyone, that there are keys to keeping out of the emergency room. I go to the emergency room way more than I should, overreact to things. What are some keys that we should be learning to avoid the emergency room, which only drives up healthcare costs?
Well, particularly this time of year and the season that we're launching into right now, some of the ways to stay out of the emergency room is get a flu shot, get the latest COVID shot. If you're over 75 or 80, you might consider an RSV vaccine as well. And the second part is, if you're not feeling well, get tested, because we have medicines for influenza, we have medicines for COVID, and all of those things I just mentioned, the vaccines and those medications, they won't prevent illness, but they'll keep you out of the hospital. I can't think of anybody who wants to be in a hospital.
Doctor, let me ask you something. I'm not going to get into a whole political conversation about vaccines or what people believe or don't believe. But what do you say to folks, regardless of their quote politics? I'm anti-vax. I don't believe in vaccine. Talk to them from a medical, scientific, and clinical perspective, please, doctor.
I encounter these people all the time, and I don't try to twist people's arms. I say a couple of things. I said there is plenty of scientific evidence that COVID vaccine in particular probably saves 3 million lives in this country. It is true that influenza vaccine doesn't always prevent flu. It is true that COVID vaccine doesn't prevent COVID, but it will keep you out of the hospital. COVID is much less virulent than it was early on. Clearly, we're not seeing the death rates, and that's a good thing. We'd like to keep it that way. You also don't want to transmit to your family members and loved ones. And I say, I get a COVID shot and a flu shot every fall, and if you don't want to do that, that's your business. But if you don't, and you get sick, come and get tested, because I can't tell the difference between flu and COVID these days. They look identical, and there are different treatments for each one.
Doctor, talk to us about this trend and the impact it potentially has on the delivery of healthcare. Independent practice is dwindling, getting smaller as larger physician groups take over. Large-scale mergers. You got Walgreens through Village MD acquiring practices at Summit Health, except all kinds of big mergers. Bigger is better. What do you believe all this means to the average citizen / patient who just wants to get health care, medical care, please?
So it's getting harder and harder, I think, to be an independent practice. The cost of overhead, the cost of insurance, the regulations, the billing. Most of my colleagues really just want to treat patients. They really don't want to run a business. And so, yes, we here at Englewood, we've grown to 700 providers, but we've also not wanted to become corporate medicine. We want to provide the best care for people. And so, yes, we have a robust physician network with all the medical specialties you can think of. And yes, we've organized them into some very large multi-specialty offices, which I think provide a convenience for patients because we're all on the same insurances. We're all on the same electronic medical record. It's all shared. But we've also kept the neighborhood feel. We've kept our local primary care offices.
How, doctor?
We keep them where they were, particularly in our urban neighborhoods where people don't have transportation. They walk to their doctor's offices. We've kept those offices open, and then we've located the multi-specialty office nearby so that when they need a specialist or they need a CAT scan, when they need a stress test, they can get it conveniently. They don't have to come to campus to do those things.
But let me ask you this. There's clearly a shortage of physicians, particularly primary care physicians. What do you see out there, Dr. Brunnquell, in terms of the physician market? Who wants to go into it? Who doesn't? And how COVID and the experience of COVID for physicians has impact? I know that's a loaded question.
Yeah, I'll grant you that's a loaded question. But I love my job as much as I did when I started 32 years ago.
COVID
And
hasn't changed that.
no, it hasn't changed that. It was tough. I will not. I'm not going to kid you. The spring of 2020 was frightening. It was terrifying because remember, this part of the world was the very beginning. We were among the first to see these folks. But we chose this profession because we love taking care of people. So if I can, like I said earlier, if I can unload from doctors' busy days, things like running the billing part and running a payroll and hiring staff, if I can take that away from them and allow them just to see patients, and there's still lots of people who want to care for folks. I think that sometimes some of my colleagues have become sort of perhaps a little bitter and a little resentful of some of the things that they've been asked to do in the last 20 years and what medicine has become. But what I do in the exam room, when I close the door and I ask you, Mr. Adubato, how can I help you today? That has not changed. Yes, I now document on a computer, which is the single biggest.
You got to do electronic medical records in real time or no?
I'm actually using an AI product at the moment to help me write my notes so I don't have to do that. But we can do that another day. But what I do in the exam room hasn't changed. I listen to what the patient has to say. I do a physical exam, and I share with them what our plan is. That part doesn't change. Yes, we have to deal with insurance companies, and we have to deal with the government, and we have to deal with all sorts of other stuff. But I'm trying to take that away from the doc so they can focus just on caring for patients.
Last question. You mentioned government. If state government were to take one action that would be helpful to help retain our much needed physicians, what would that be?
We're having difficulty right now, Steve, getting our new doctors credentialed on insurance plans. So when I hire a new doctor, and we take all insurances at Englewood. I want them on the insurance plan so that when people come to us, they can be insurance agnostic. It doesn't matter the coverage you have. We'll take care of you. We wanted to get rid of that barrier. The insurance companies are dragging their feet. And I would love to see the state do something to say, hey, listen, if there's an eligible certified doctor who's capable, has the documents, and you have that documentation, here's the time limit. You have to include them.
Dr. Stephen Brunnquell, I want to thank you so much, Doctor, for exploring a whole range of important issues that affect all of us, regardless of where we live or the issues we're dealing with medically, clinically. Thank you, Doctor.
It's been a pleasure. Thank you, Steve.
You got it. Stay with us. We'll be right back.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation, celebrating 30 years in public broadcasting. Funding has been provided by EJI Excellence in Medicine Awards, the New Jersey Economic Development Authority, the Russell Berry Foundation, IBEW Local 102, New Jersey Children's Foundation, Seton Hall University, the Adler Aphasia Center, Delta Dental of New Jersey, and by the Port Authority of New York and New Jersey. Promotional support provided by bestofnj.com and by NJ.com.
I'm Tim Sullivan, CEO of the New Jersey Economic Development Authority. Since joining the NJEDA, I've been struck by the incredible assets and resources that New Jersey has to offer. The NJEDA is working every day to grow New Jersey's economy in a way that maximizes the values of those assets to benefit every single New Jersey resident. This includes more support for small businesses and a focus on reclaiming New Jersey's position as a leader in the innovation economy. Visit njeda.com to learn more about how NJEDA is building a stronger and fairer New Jersey economy.